Hi everyone. Good evening. Welcome to Just Banter. And tonight we're going to be talking about the COVID-19 pandemic. A lot of people have been going through a lot of stress mentally, physically, emotionally, financially due to the COVID-19 pandemic. There's a lot of confusion. There are a lot of questions that need to be answered. But there's a few people out there, you know, able to actually give answers to what's going on. In as much as it's caused quite a lot of disruption, it's also created opportunities for a few people. There's some companies, some businesses who have seen opportunities, been able to pivot. They've been able to address whatever challenges are there, and they've been able to stand up and make the best out of the situation at the moment. But first, we're going to be talking to a very good friend of ours, a public health specialist, somebody who has been on the front lines for quite a while, even before the lockdown in Nigeria, because she's actually in Nigeria. She's a pharmacist. She works with one of this world's health organization accredited bodies, and she's here to tell us quite a bit, we hope, about what's going on. I'm going to welcome to the show Moyosola Abbas. Hi, Moyo. How are you today? Moyo, can you hear me?
Hi, Habib. Hi,
Hello, Moyo. Can you hear me, Moyo? You have to speak up a bit, I think.
Hi, Habib. Hi, everyone. Nice to be here.
This is your voice. The viewers, eh?
Yes, I
They'll
can.
be asking for your phone number after this.
I said, hi, everyone. Can you hear me now?
Yes, I can hear you, but it seems that there's a lag. But we can hear you. Are you there? Hello, Moyo.
Looks like I lost you.
Moyo's internet connection seems to be. Yes, your internet connection seems to be lost. Or is it slow? Okay, so I think we lost Moyo there for a bit, maybe till she gets back. So there have been quite a few issues around this COVID-19 that have been talked about. In Nigeria, there seems to be so much confusion. And I just don't understand why there's so much confusion in a country that's got so many fantastic people, such bright talents, people that have got the brains to make things happen. So why do we have this situation in Nigeria where nobody understands what's going on? Why do we have a situation where people are keeping outside of banks, trying to get access to banks and banking halls, and trying to figure out what's happened to their money, to their money transfers? Why can't people get access to medication? It's unbelievable that's happening in a country like Nigeria that's got so much potential. And we've asked so many questions from different people. And if you're watching and you'd like to join the show, please do so and send in your comments. And we'll be responding to your comments as they come in. I see quite a few people online. Hello, Sonia Shubawale. How are you doing today? It's been a while. We're glad you're on tonight and listening to us. So, anyway, part of the problems that Nigeria has, internet connection. It's unbelievable what happens in a country like Nigeria. And there's so many opportunities for people to be able to fill in the gaps and actually provide a lot of these services for Nigerians. Why are they not doing that? It's not their fault. It's actually the fault of the governments. I think, they're not creating an enabling environment for people to be able do business. Business in Nigeria is pretty tough. Everybody's finding it difficult to adjust, especially those who have, you know, had some success before, probably 10, 15, 20 years ago. Right now, they're finding it pretty difficult to figure out exactly what is going on in the system. I mean, I've asked questions, I don't know. I'm not in the position to actually answer those kind of questions, but I guess that's what's happening. I think we've got Moyo back. Let's see.
I'm back. I'm
Hi, Moyo.
sorry. So this,
Oh, yes.
yeah.
You're
Hi.
connected much better now.
Cool. Sorry about that.
No, that's fine. We know what the challenges are in Nigeria. Like I was just saying to the viewers, this is part of the challenges of Nigeria. Internet connection, poor
That's right.
infrastructure
That
all around.
that's right. So imagine working from home under these conditions.
So you're working from home right now under these conditions.
Yeah, I've been working from home on this under this condition.
And how are you finding it?
I mean, it has its moments. It's been mostly good. Just once in a while, I have these like interruptions with the connection. But I would say
Okay.
most of the time, I'm able to take my meetings, so that's fine. Mm, um, I do miss having people to talk to. You
Well,
know,
everybody does.
I miss like my teammates, my colleagues, just seeing other people. But so it's not as bad as I initially thought it will be. I think I have developed coping skills.
Yeah, well, human interaction is an essential part of
Yeah,
you know,
it is important.
a human being's well-being, and a lot of people, are finding it difficult to cope.
Yeah. I,
So I can't imagine what it feels like for a lot of people.
yeah, to be honest, I think like for me, work has been a good distraction. I mean, I do have something to fill my time between 8 a.m. and
Yeah.
6 p.m. And of course,
Okay.
because I'm working remotely, a lot of that has to do with like calls. So I get to be in contact with other people, you know?
Yeah.
So take a lot of meetings, do a lot of collaboration, make voice calls. That helps. Uh,
Okay.
it fills up the gap. And then like, okay, so I get off work 5:30, 6, sometimes even 7, and then I have something that has filled my day, and I don't have to like worry or like be
Yeah.
alone in my thoughts for too long. Yeah, so
Yeah.
it's a good distraction. I'm having to work. um
A good distraction.
yeah,
Well, a lot
that's
of
how I
people
would
don't
find
see it
it.
like that. A lot of people don't see it like that. A lot of people are having a lot of challenges with having to make do with whatever it is that they're earning. Now that the
Yeah,
pandemic has come up, it has now made things much, much, much worse. Now they're scared, they're panicky, they don't know what's going on. They're
yeah,
trying to figure it out. What exactly is
yeah.
happening? Well, can you tell us what's going on?
Oh, I mean, I appreciate the way like how people feel. There is a lot of, I would use the word anxiety, because this is unprecedented. This is one of those
Yes.
things where we've all watched the movies, right? And it just seemed like a
Yeah.
worst case scenario kind of thing. And no one, I mean, there were predictions. Um, Clearly, the epidemiologists and, all the scientists had been worried
Hello.
about this scale of pandemic, the global pandemic, but we all thought it was far away, and we all couldn't like really imagine it, like the world literally shutting down, right?
Yeah.
Yeah, but this is something that experts had been warning about, since the Ebola outbreak. There had been these warnings that we may have this kind of global pandemic on this scale, and people, we were meant to be prepared for this, but somehow, we just didn't prepare. And I think most people also kind of envisioned this kind of being a bioweapon scenario. So nothing
Yeah.
natural, but something deliberate by some world power or some, people somewhere. So it seemed quite far fetched to,
Yeah.
yeah, to really put into perspective. But yeah, it has come, and every time I sit and think, and I ask myself, okay, so are things going to go back to normal? And there are different levels of normalcy. For example, I know for I'm not going to shake anybody anytime soon. Like shaking hands. Um, it's not going to happen anytime soon. But yeah, there are different levels of that. Like it could be something as
Yeah.
minor as will you shake hands, but then it's also like what's the future of certain businesses, that have been greatly impacted that by this. For travel, for example, I mean,
Yeah.
I my work requires me to do it quite a bit of traveling, and I just keep trying to picture how do I get on a plane and not lose it. Staying in a hotel, eating out at a restaurant, how do we navigate all those what seem to be so normal and so basic,
Yeah.
things like yeah, aspects of life. So I mean, people have these discussions and they try to predict, and I'm like, okay, do they really know what they're saying? But I guess we're all just navigating through it and trying to like come up with a best case scenario. But that being said, this has impacted people like in on so many levels, particularly economically. In a country like Nigeria, it's just like unimaginable. Um, Most people kind of like earn a good chunk of the Nigerian population kind of like earn their way daily, selling things, all the informal people selling things by the roadside and the market. So locking
Yeah.
people up has been really devastating. And this is what I
Now
tell
that,
people.
sorry, now that you mentioned that, yeah, that brings me to the issue of infrastructure. So I think it's time to bring on our other guest. His name is Marc
Okay.
Adebesin. Marc is a healthcare IT specialist as well, and I think he should be able to contribute when it comes to the issue of infrastructure here. So, hello, Marc. How are you? Can you hear us, Marc?
Yes, no, I can. I was muted, sorry.
Okay, your volume is a bit low, so we're struggling to hear you.
Okay, can you hear me now?
Yes, a bit.
Okay,
Yeah, Marc. How are you today?
not bad, not bad.
All right, that's great. So the other guest, her name is Moyosola Abbas. Moyo is a public health specialist. She's a pharmacist and she works in one of these international organizations. And she's here to tell us about a bit about COVID-19. And in the course of the discussion, the issue of infrastructure came up. So I had to bring you on. It was about time I brought you on, so that you could, give us a little insight into what you think are the infrastructural deficits that we have.
Okay. I'll answer your question first. To the question. Good evening, Moyo. Are you based in UK? Or are you based in Nigeria?
Moyo is in Nigeria. She's
Okay,
one of
good.
the international
I would answer that question, painting a scenario, and maybe that
Okay.
scenario will help you understand where we are as a nation. Now, I had a friend who's been trying to bring me into the Uber business for a while, and he has about 10 fleets of Uber cars that he operates in Nigeria. And
Okay.
one of his drivers on the 31st of January this year, he just disappeared with the vehicle, phone call switched off. And about 9 weeks after, about 6, 7 weeks after, he ended up calling the boss and went off for another 2 weeks. Apparently, on the 31st of December, I went to Nigerian Military International Airport to pick up a passenger or a client,
Yeah.
and it was a Chinese dude. And the guy actually, I think that was where he said he contacted the coronavirus, but he had tried all sorts of things, your normal malaria, chloroquine, typhoid. He ended up going to the village. His brother took him down there, and he ended up with all sorts of herbal remedy, your agbos and all that. And then, obviously, he got cured. Now, that is one of the so-called statistics you would never hear of.
Yes.
Nobody's gonna call the NDC, DC, or whatever it is they call them in Nigeria. That I had coronavirus and it left, because the friend of mine I'm speaking about actually owns a blog, and he even said he was willing to pay the guy to come on air and speak about his experiences, so that his experience, other Nigerians will be able to learn from it, and that mistake will not be made, so that they can actually
Yes.
understand that this is true, and it's not just a media frenzy. And he said he wouldn't do it. And the guy asked him, the question, why wouldn't you want to do it? He said, because in Nigeria, the minute you say you have it, even when they know you're cured, they will stay away from you for the rest of their lives. If they have that opportunity, they will stay away. And I've also heard of people who have actually died and they've actually not reported it. This is both here in UK and in Nigeria. It's shocking. Yeah, you hear some of these stories where people catch these things and they don't notify anybody, and they just bury the individual in the compound. Over here in UK, we have a very good IT health infrastructure where if anything happens to me, happens to my brother, my sister, my mom, my kids, there's a track record. The last time I went to the hospital is well documented. What type of ailments I had. When I clocked the age of 40, I was called. I was told I needed to do, all sorts of tests, and as a typical example, I was told I needed my cholesterol level to my blood ratio was, I need to watch out for that. We don't have those type of things in Nigeria, because we do not have a database or a record of what kind of ailments any individual has. There's no track record there. My blood type, nobody would know it in Nigeria, unless, I could have an accident and nobody will be able to tell. If I find myself unconscious, there's just no way they're just going to pass any kind of blood into my body, because nobody knows it. But over here, if I have the slightest of actions, the NHS would know what type of blood type I have, what type of ailments I have, what type of allergies I have, because there's a record, there's a database, there's an ERP system that stores all that information. And we don't have that infrastructure in Nigeria, and that is going to have a tremendous effect on how doctors, pharmacists will be able to do their job. And then you have all sorts of drugs where there's no clear-cut category of the type of drugs that can be prescribed over the counter and the type that a doctor would have to prescribe.
Moyo, can you tell us about that?
I disagree with you,
Okay.
Mark, in some of the categorizations. It will slow down, not having that, electronic record for the clinicians to easily refer to and see like the patient history or the patient profile does slow down treatment. It clearly, but then it just means that these are additional tests that have to be done before treatment can proceed, as opposed to it not being available at all. And those things not being factored in. No doctor is going to transfuse anybody without knowing the blood type. That's a no-no. But it does slow down. Yeah, you're right. It does slow down. It may lead to a loss of efficiency in initiating treatment. I would admit to that.
Okay. It could even lead to loss of life, because I lost a cousin this year to an accident. And one of the things that they couldn't do was, they couldn't diagnose him, with his blood and all that, because he lost blood on the spot.
Yeah.
So,
there's no debating that the healthcare infrastructure in Nigeria needs to be strengthened. It is weak, and I think that is one of the main opportunities that will come out of this COVID. Like the lockdown came and everybody's stuck. Everybody's here in Nigeria, so there's no running away. You get it. You fall ill, you have to access the clinic here. I think that has become apparent to the people in charge to everybody, the politicians, right down from the local government up to the top, because the responsibility cuts across, and it's clear. And I'm kind of optimistic. I'm an optimist though. Um, and I believe that there will be lessons learned. I do know, like, there are plans, there are conversations around, okay, so how do we strengthen the infrastructure currently? And I think, like, that's one of the good things, probably even the main good thing that can come out of this experience for us in Nigeria. Often, the health budget is slashed. If you look at the budget year in, year out, a huge chunk of it is on just recurrent expenditure, salaries, and maintaining, current status quo, as opposed to real capital investments in improving the infrastructure, upgrading facilities, really training healthcare workers. That has really been dependent on a lot of international aid and international bodies. And that's even in the public side. If you go to the private sector, you it'll be interesting to see the data on lending. How quickly has it been to get a commercial loan from any of the banks in Nigeria to fund a hospital or any healthcare related business? I mean, if it's not oil, or if it's not one of the quick wins, you don't even get the support you need. So from both sides, from both the public and the private sector, there will be a lot of opportunities within Nigeria for strengthening the infrastructure, for health, strengthening the entire healthcare system.
Yeah, I think there's a two-way debate to that, because if you look at where we are in terms of telecommunication infrastructure, it's not going to be viable if that infrastructure is not there. And I'll give you a typical example. There's an application called Clinic, which is an ERP system that houses database of you can either call them clients or customers, depending on what optics you're using to look at it. So it's typical of what we use here in the UK, whereby everybody's track record is there, and there's a unique identifier. Typical example, everybody has got a unique identifier now using a BVN number for bank accounts. So you've got that infrastructure there. Now, there are two types of solution that could be deployed for that. You could either have an on-premise solution or one that sits on the cloud. In a country like Nigeria, where electricity is not constant, internet may not be constant because of the electricity dependency. So you find out that how, yeah, so so you find out that there's a lot of dependencies on this thing. And to be blatantly honest, Nigeria as a nation, I think we're one of the most blessed nations in the world. There's hardly any mineral resources you can mention that we do not have in Nigeria today. And Britain, as a typical example, they don't have everything, but they seem to be able to use their brain to create an industry in every single sector that exists. The government, what the government has to do, I don't think it's far-fetched, to be blatantly honest. And I think the telecommunication companies also need to chip in. Nigeria is the only country, not the first, the only country I know where you would invest to build a telecommunication company and you would have a profit margin in your first year. It's never happened in the history of the world. Nowhere on earth. MTN made a killing in their first year. Econet did the same thing. What the government needs to do is place out simple laws whereby they say they want to roll out an infrastructure very similar to what we have in the NHS. I don't see any reason why we cannot have that in Nigeria. You don't have to be a scientist to be able to create an application that would do that. All we just need is that constant connection to the database in the cloud or the on-premise one. With constant internet.
Sorry, that brings to the fore a couple of issues that people have noticed, and the initial one is this: a lot of monies are being disbursed.
Correct.
Where that this money is going to. That's one.
Yeah.
Two, even though some people are claiming that these money are being spent. There are some states that we have seen some rather disturbing news. So there's a footage, there's on social media, but we don't have a right to air it, so we're not going to air it, but we can talk about it. Of a video that was shot in the Sani Abacha Stadium in Kano, where the government said they spent billions, but there was actually nothing in the isolation center. The isolation center is in the stadium. They have beds and all that there, but they're just stacked. No equipment, no staff, no patients. Right? Now,
Yeah.
a lot of things, that people have been saying is it a case of this COVID-19 is a farce? Or why is it that you have some states saying that they don't have any patients or not being able to diagnose anybody, positively, like Kogi State, for instance? So the commissioner or somebody from Kogi State was just saying, today, this afternoon, that somebody came from Abuja to Kogi State and he was tested positive in Kogi. So they cannot say that Kogi is experiencing COVID-19.
Oh my
is there
gosh.
a misinformation somewhere? What exactly is? I mean, it's so baffling that you can have this type of situations, in a country like Nigeria of almost 200 million people, and you have the amount of talents that you have the amount of money that you have billions being dispersed every single day. Is it now a business?
So, Habib, let me jump in there. I think like part of the frustration, and I want to allude to this, like the government has repeatedly failed the people,
Correct.
and there is a fabric of distrust in the system, and so every time something comes up, there is always this story, or this story to say, is this really true? I I I totally, understand and even like probably share that frustration of the average Nigerian, because if you've been lied to, if you've been deceived more than once, repeatedly, then that
Yeah.
distrust will be there. But then,
Mhm.
I do want us, to follow the numbers and follow the data and think objectively. I remember when the first case was diagnosed in February, the Italian guy, there were people all over social media saying, oh, it was a lie. This is just a way for the government to make money. I understand why people may suspect the government of that. But then
Okay.
if we take a step back and just look logically and see, okay, what kind of virus is this? How does it
Mhm.
spread? It is not unimaginable. It makes absolute complete sense that the virus came into Nigeria. I
Correct.
mean, from all the travels and everything, it is it makes absolute sense that we have the number of cases that we do right now. If you think of how aggressive the the virus transmits in other places, and I will say this, it is clear from the from the data from Africa that we are even benefiting from lower transmission rates, because
Correct.
if you
Okay.
look across all African countries, from like the first case that was detected in Egypt, it's been 100 days since that case. And if you look at the graph of the epidemic, it hasn't gone wild like it has in other places. There is an issue of low detection because of low testing. That everybody would allude to. However, even in African countries where testing has been scaled up and they've had high testing rates, like Ghana, South Africa, Senegal, that number of cases hasn't been exponential. So there is something to support the fact that the transmission is low in Africa. That may be related to the demography. We do have a large population, but we have um, our population pyramid is such that we have a large number of young people. People less than 30, people less than 50 make up the bulk of the African population. So that may also be some of the reasons why that transmission hasn't been aggressive. It makes absolute sense that there will be cases in many states in Nigeria. Kogi is so close to Abuja, so it does make sense that it's somebody who traveled from Abuja to Kogi that that's the first case of COVID there. So I just would like us to step away and cut through the sentiment.
Mm.
Has the government failed people before? Yes. But we're not even testing enough, right? The WHO, for example, recommends that you test aggressively such that your positivity for COVID-19 is about 10% or less. Right now, with the testing that we're doing, it's about 18%. So we haven't tested enough, and so there are more cases out there. There is nothing in my own case, from my own experience being in public health, there is nothing suspicious about the numbers. But I do understand the frustration on the part of the citizens, and I do understand how, that frustration can facilitate these, several alternative theories. Let me use that term to explain
Okay.
what is going on. I saw on a friend's WhatsApp profile yesterday that over 1 billion naira will be given to each state that has at least one case of COVID-19. And then the person linked that announcement by the finance minister to the two cases that were identified in Kogi just yesterday. Like, oh, when money is involved, then all of a sudden Kogi has cases.
Kogi now has cases. Yeah.
I
I
just
mean, that's
really,
pretty amazing that stuff like that
yeah,
will
but
come up.
then how does it align with the fact that the commissioner is now coming up to even disown these cases? I just want us to, as professionals, let's be objective. Let's look at the data. Let's look at the patterns of of how the disease spread, of how COVID spread in other countries. And one, first of all, be thankful for the fact that despite the weak health system, or the not so strong health system that we have in Nigeria, that things haven't gone out of control, and kind of help educate the people around us. Because as one theory goes from one person to the other, it keeps building, it keeps spreading, but then we can cut through the bullshit and help give out the correct information out there.
But would you say the statistics that are being displayed, I don't think those statistics are in any way, shape, or form correct.
Why?
I've had I've
Why?
had people in Nigeria that I have spoken with that have had this COVID-19 like symptoms, and they've actually treated themselves at home. They've not even bothered reporting to a doctor.
Treated
There
themselves
are
at
about
home.
four.
That's pretty curious,
So
Mark.
you know
It
that that
is.
is not
It is.
unique. That is not unique to
I agree.
Nigeria. Yeah.
I agree.
So the ability to test, the truth of the matter is, I don't believe in every country we have been able to see the true number of cases, um, active COVID cases. I give you the case of New York. What they did was to go back and do an antibody testing for a certain percentage of the
Mhm.
population. So they conducted a survey, and they found about 12.9% of the survey participants had antibodies for COVID, right? And so they
Yep.
kind of estimated that it is possible about 10% of the population were infected, and in actual diagnosis, what they have diagnosed is far less. That is a clear case, scenario, but it isn't a deliberate attempt by the government to manipulate the figures. The number they release in terms of confirmed COVID cases will
Mhm.
always be based on tests done. In the case of Nigeria, the polymerase chain reaction test, right, to confirm actual active COVID infection, right? And that's what they will go by. Now, even outside outside Nigeria, the additional analysis that have been done, on general population to supplement, and have a clearer idea of the epidemic. But it doesn't mean that the government is underquoting cases or deliberately manipulating the figures. No.
So Moyo, in a lot of cases, we understand that you don't have a data system in Nigeria in every sector, and people like Mark, have come up, with applications that could be beneficial to the system. They rarely ever get the opportunity to plug to the system to deploy these solutions. Now, without data, what can you truly do? There's almost nothing. So instead of us speaking big English every day, and everybody being intellectual and everybody just let's get to the nitty gritty. People are infected in Nigeria. We know that for a fact. Why? Because a couple of people have been diagnosed. Secondly, from all the facts that we have been given so far, this is a highly infectious virus. But unfortunately, what most people are doing is they are tackling this like bacteria. Why? Simply because there's no data, there's no information. I don't want to use the word, on air, but unfortunately, the situation is distressing, to say the least. It's terrible. I mean, how can you walk into I've seen pictures, tons of pictures, where so-called banks were putting out tents and all whatnot, and a lot of people were doing PR and all, a lot of PR stunts. And the pictures they were showing were pictures of empty tents. They put in beds, no equipment, no staff, no patients. Then people are saying that, some people or some agencies or some, organizations were giving billions to the government. Where are the billions? Where has this money gone? What exactly, are Nigerians doing that just don't ask questions? Before I go on, one of our viewers said Nigeria's health system, like every other facet of our socio-economic life, is 60 years of failed promises. So trust is a luxury Nigerians cannot afford. That's how deeply disturbing the situation has become. Where does technology merge with medicine to develop the health sector in Nigeria? Where do we start? Because I think we need to stop talking about the challenges. We now need to start talking about solutions. Mark.
Well, this application, as a typical example, is something that we're willing to give to Nigeria free.
Yeah.
Deploying it free. I don't see any reason why, the health minister shouldn't be looking at an application or a solution like that for starters. It's also something that we're willing to give, even if it's at the state level. You could try, willing to give a state or two a trial run, deploy it, so you can use that as a test bed. Because I think right now, not even in the future, right now, data is the new gold. Data mining is, if you know how to mine data very well, the likes of eBay, the likes of Amazon, they've been able to prove that time and time again, going into different businesses, and they've been able to be able to get tremendous amount of return on investment based on X and Y different types of analysis that they've done on their market research. Sade did say something when she started that conversation where she said the government has failed us as Nigerians, and I totally agree with her, because the solution to the problem is Moyo. Sorry, my apologies for that. The solution to this is not something difficult. You don't have to be a scientist to know what the solution should be, because we have private clinics that actually use this type of infrastructure in Nigeria today. Not one, not two, not three. Yes, of course.
Well, that's
you can't walk into St. Nicholas today. And I mean, when I went to St. Nicholas, I had appendix. That was where I did my appendix I was barely 13 years old. Even back then, they had an Excel spreadsheet they were logging in
Yeah.
details into. And because I was being treated with a bank insurance because one of my parents were working in the bank and the insurance covered me. So obviously there's a link back to, okay, who's going to pay this guy's bill? So
Yes.
they had a database back then. Yes, it might have been an Excel spreadsheet, but if you go to St. Nicholas today, they would have that form of, I mean, if St. Nicholas has it, and I know for a fact a lot of private clinics have that for their customers. So if the private entity can have this, what is it going to cost the Nigerian government to have this? But without the infrastructure of telecommunication having proper electricity, being able to make that work effectively and efficiently would not be something that's going to be economically sustainable or economically viable for the Nigeria as a nation.
Okay.
So,
So,
Moya,
Yeah, I agree with you, Mark. A lot of private hospitals have their own EMR systems and their own electronic systems. I haven't entered anyone in the last 3, 4 years that doesn't use an electronic system. That's the reality. And I do know some public hospitals as well that have that. I'm aware of some state governments that are prioritizing um, certain tertiary and secondary hospitals for the use of EMRs. It isn't widespread, but in the course of my work, there are also like disease programs. A lot of work has been done on electronic medical records within the HIV system and within the HIV program, and massive investments. You are right. One of the key challenges to the success of that has been internet connectivity. It has also been power, and the most successful solutions are the ones that allow offline operations with certain sync and upload functionality at certain times daily. That's how it has worked, and I do know that even within that system, companies have had to explore alternatives like using solar desktops to f-
okay, okay.
to roll out those electronic systems. With mixed results. Sometimes you find commitment from certain hospital management, and they're willing to power, generators to make that EMR system functional. And sometimes you're not, depending on the location, depending on just something as simple as even the personality that the person in charge of the hospital. If you meet a CMD director who's CMD who is futuristic, the head of a hospital who is futuristic and understands, like appreciates how this will make life easier um, for him and the
For
rest of his
Nigerians.
team. Yeah, and they invest in that. But then I just gave you like a snapshot of some of the solutions programs have had to explore. So within certain
Mhm.
disease programs, the TB program also has a very good, system for client level data management. And within those disease programs, investments have been made. Skills, healthcare workers, and we call them medical records officers at the health facilities. Their capacities have been built to manage those applications.
Yeah.
Um, but integrating it as a whole into, rather than having fragmented disease programs have their own systems, and just bringing that into general health patient care and outpatient care has not been done successfully. And
Okay.
but then, I agree with you, big opportunity for that. This has demonstrated the need for that. Some people have introduced biometric functionality, for unique identifiers, either a thumbprint system or like a card, where that stores your information, and then, you can move that around and you have that synced. But it's still
Yeah.
within a closed network. So I
so
agree with you. It's a huge opportunity. I'm going to throw it back to you to say. So then, how then do you sell this solution to the people who need it? How do you market it? I've worked
Well,
in an area where the donor brings it, and we collaborate with the government, and it's accepted. but then coming from the private angle.
Mm. Well, I think
Sorry, Mark.
yeah.
Moyo, from what you are saying, sorry, Mark. From what you're saying, one thing stands out and is obvious. All of us have realized now that the difference between Africa and the developed nations, excuse me, is process. That is all. There is no perfect system. The only reason why you have the type of healthcare systems that you have in the Western world is because they've been able to put in the processes to be able to move things from point A to point B to point C. Now, in Africa, you don't even have the process to even start with. So how can you even develop, databases? How can you partner with the likes of Denmark to put these systems in place? So, Mark, can you tell us about that? How's that possible?
Well, for starters, Moyo mentioned something. She said fragmented. The solution that each and every government, you can't call it the federal, state governments, and all the clinic or hospitals that have this different ERP system. What they are doing today for a nation like Nigeria and for Nigerians is they're setting us up for another problem that's going to happen in the next decade or two. Let's say in the next 10 years, working just fictitiously, everybody now has their own ERP system. I have an accident, God forbid, on the road on my way to Lokoja or Abuja or Sokoto.
Yes.
Are you now telling me that there shouldn't be one single central database system? If I was born in Germany, if I have an accident in Dusseldorf or I have an accident in Munich, it is the same ERP system that would be called upon to find my track record. However, if it happens in UK, the same. But if it happens in Nigeria, they have to look for the doctor of my own clinic. What if they don't know it? Which 99% of the time, they will not know it. So it would be good if the government can bring, I don't want to use swear words online right now, but if they could do the right thing, it's very, very, very simple. Look for a single ERP system. And they need to make it mandatory because we've got three arms to the government. The legislative arm should be able to say, make it as a law, as a policy. Everybody needs to connect to this database. Now, they can now put different policies around it because we seem to be a nation where there's always a rule for the elite, there's a rule for the people in government, and there's a rule for people like you and I, the normal Nigerians, where some people will say, oh, I wouldn't want my data to be, on the public domain. Yes, nobody's data is going to be in public domain. That rule should be, it should be a standard rule across the board. The only people that would have access to that information will be your doctor or people that have a specific administrative right to those type of data. Now, if the government can put in a rule of law that states that each clinic needs to be plugged into one single ERP system, it's a win-win solution for the Nigerians. It's a win-win solution for the government. It's a win-win solution for the private sector. It's a win-win solution for people like Moyo. It's a no-brainer. It won't cost the Nigerian government too much in terms of being able to put that infrastructure in place. I'll be blatantly honest. It just takes you 2-3 servers on the cloud, and the solution will cost you a couple of $1,000s. Now, you've mentioned so many programs: the tuberculosis, the HIV, the blah blah blah. There's so many different programs. I can single-handedly fund this solution for Nigeria, but will the Nigerian government, will they be willing to put that rule of law and say everybody should use this single solution? That is what the problem is. The Nigerian government to speak with one voice it's tough to even get the governors in the north, the ones in the east, and the one in the north and the south to even agree on a single rule. It's difficult. So this has to come from the federal level before it comes to states, and then the state now implement their own rule of law and say this is how everybody should be plugged in. So to be honest, it's not a big problem. Let's be blatantly honest. It's not a big solution as well. But are the key stakeholders who are willing to actually take that bold step and say this is what needs to be done? I mean, I've heard of when the pandemic started in Nigeria, I've heard the likes of Otedola and Access Bank, Dangote's and the likes. They've given the government money, and where has that money gone to? It's gone into thin air. I'm sorry for not being pedantic, but if I was Dangote, I'll tell people to land up in front of my house and open my trailer and say, come and start carrying one bag of beans or rice. That giving it to the federal government. The government,
guys,
that's easy to say. Mark, that's so easy to say.
Guys, like I will say this
painful.
again.
I get your point, of course.
I get the frustration, but I would avoid from just using all these broad strokes to say the money has gone to thin air, blah blah blah. I mean, no, it hasn't. Like, no, it hasn't. If it has, you don't even know that. Like, it's just that suspicion from the past of, we don't trust the government.
I think Moyo is sitting on one of the bag of rice.
No, I'm not. First of all, I don't work for the government. I don't work for the government. But I strongly, I do believe in all of us, being objective, and I'm making like constructive criticism. Honestly, I'm constantly fighting with people on this.
What is it going to cost the Nigerian government?
It doesn't help when we say all these things.
The cloud.
To pay for what?
To pay for a couple of servers to be on the cloud, and then hospitals in Nigeria connected.
I reckon
that machine.
The funny part is this: I happen to love.
You say it so easily, but
it is.
But it is because
it is. Let's be honest.
Moyo,
we all do, and we've all benefited from the efficiencies, technology.
Oh yes. At some point, yes, but these things are simple solutions that
BVN was implemented in Nigeria under how many years? Everybody was in and had that number. If they say everybody should go and register and have a national identity card, you'll be the first on the queue. Why is it difficult?
Mark, I'm happy you brought that up. I'm happy. I'm happy you brought that up, and I just want to give that as an example. Like, so they've done BVN, the government has done BVN. Right now, I cannot renew my passport without getting a national ID card or a national ID number.
Okay.
They're linking these systems. It's slow, it's frustrating, but at least they've started, So, like, I would say
this healthcare solution is way more important than that. Nigeria is the only country, as a typical example, who does 5 years validity for an international passport. They only just changed that. Now they are doing 10 years. Why is it that our federal government takes so much time to do the right thing and take the right steps and put the right strategies in place? We have arguably some of the best and wisest and the most brilliant people on the surface of the earth. Why are we so difficult to work with and fix?
So let me ask a question, Mark.
You are in Germany, me, I'm the one in Nigeria.
So Mark, let me ask you guys a question. So do you think that this is a case of bad leadership or bad followership? Why
bad leadership? Bad leadership. And the reason why I would say that is bad follower is bad leadership is simple.
Yes.
You, I want to believe Moyo were alive when Idi Agbo came to rule Nigeria with Buhari. Okay. Everybody followed suit. Are you now tell me if Buhari says I'm taking this with a iron hand? Nigerians need to be seeing you now. Buhari has showed you Pepe. Yes.
Is it Buhari that showed that Pepe?
Is it that complaining there's powers? No, they're taking the light. So are you trying to tell me if an individual like Idi Agbo were alive today?
I'm laughing.
Yes.
Your voice is louder than you. I'm not going to comment on personalities. There has been a failure of leadership, but I also do know this about Nigeria. Even we, the citizens, don't. I mean, we're not the best of people. We do not behave. I don't want to come out here with my frustrations, but every day I go out and I see several examples of Nigerians behaving badly to each other.
Yeah. Yes.
So when you say it's a failure of leadership, I'm okay. So is it that the leadership has failed so much it has permeated?
Okay, Moyo. I know where you are going to. Are you now? I agree with you. When Idi Agbo was alive, what happened today was still happening back then. But Idi Agbo as a leader dealt with the people with a iron fist. And if you dealt with people with the iron fist, very good strategy. If you know that's the kind of strategy that work with your followers, use the iron fist, make sure they do the right thing. And I used to queue to enter a bus. Why can't
But
people
you
queue
can't do
today?
that you can't do that in a democracy.
Now you go
Oh,
to Lagos.
no. When I say iron hand, it's about saying if you do not queue, as a typical example back then, you'll be whipped. If you know that is what will make Nigerians move, if Nigerians want to behave like goats, treat them like goats. If you know it's going to be for the benefit. Imagine what war against indiscipline followed from back then till today. Nigeria will be a better nation, just like it has just
Hey,
been a better nation with
can
Moyo.
you see my
Then
power
bringing
is
back the
back
light.
on? Can you see that my power is back on?
Congratulations.
Okay.
Congratulations.
I mean, to me, I don't want to delve. That's a longer conversation. What it
Correct.
will take, to rebuild Nigeria, to reconstruct Nigeria. Um, it's a long conversation, and I do know like it's not going to be done in
In a
one
day.
year, in 2 years. It's how in the past we had that whole vision 2020, and 2020 came and the vision was not achieved. But we will have to follow the models in Asia, in China, Malaysia, Indonesia, to see how they were able to build and transform the country. We need one solid plan, 20-year, 30-year plan for for restructuring the country, for developing the country, such that it doesn't even matter which party is in power. Whoever you are just going to vote for who implements the plan. Whatever party you vote for, that is the master plan. That is the Nigeria Economic Growth Recovery Plan. I know there's one like that right now, but I'm just saying, like, that's everybody keys into it and we follow it hook, line, and sinker. I won't support any form of authoritarian regime or, anything that would violate human rights or treating people like scapegoats. But I do think, like, oftentimes people excuse their position in life for why people behave badly. Even middle class Nigerians that are better off and are and can afford the basic necessities of life would give excuses as to why, they're behaving a certain way. And I'm like, if you are talking like this, you have a choice. Things are within your control, but you think it's okay for you to drive on the sidewalk, run through a traffic light. I'm just giving you minute things. These are things that everyday people do. Come on, it's ridiculous. There has to be some level of self-discipline, self-regulation. It's not just, the government must hold one stick to you or send you to jail before you
Nigeria will
behave
not change with your
Why
strategy, Moyo.
must you
That
be
strategy
flogged?
will
Why
never
must you
work
be
with
flogged
Nigeria.
before? Why must you be
Mo,
flogged before you are proactive?
it's very simple. By
Why?
the time they flog for 1 week, in the second week, everybody will fall
come
in line.
So
Mark,
It's the way.
we
It's
will
just the way the Nigerians are.
so hang on,
we
hang
will
on.
do that if you move back to Nigeria to come and live with us, so that you
So
can
hang
be
on.
flogged.
No. I will follow. I will always follow the rule.
Sit down in your
So
cozy
Mark,
little, your nice
No,
chair.
because
And I'll be
no. If it didn't work, it's a different issue.
sorry,
When the DRZ
sorry.
prevented it, it didn't work. It worked. It
Hang on,
worked.
hang on
different
a
time.
second. Hang on. So the reality is this: if people don't hold themselves accountable,
Thank
if
you.
you have to force them to be accountable, then that means you will always have a high crime rate because people will always break the law. That is why I asked, is it bad leadership or bad followership? You don't have to have an authoritarian government for people to learn to do the right thing. You don't necessarily have to. Nigerians are not animals. Why can't we wake up and act like normal people? I'll give you an analogy. Something happened to me several years ago, maybe about 20 years ago. My house is really, you have to drive maybe about 2-3 minutes to get to the major T junction. Okay. Now, 2-3 minutes, but it takes you maybe about 30-40 minutes before you get to that junction every morning. Why? Because people at that T junction are just impatient. Nobody wants nobody wants to say, you know what, just go so I can go, kind of thing. Everybody locks that junction and then they're there. Sometimes you could be there for 2-3 hours. So there's this particular guy, he the quintessential, description of a madman, in Nigeria and all that, wearing rags, carrying the plate under his armpits, that kind of stuff. This guy is always at that junction every day. This guy notices what was going on. Mark, he steps into the middle of the junction. And then he starts to direct traffic. Mm-hmm. Now, people that are doctors, professors, lawyers, the typical Nigerian, I would say, do you know who I am? Kind of people. We're actually listening to this so-called mad guy directing traffic, and traffic started to flow. It tells you something about the mentality of our people. It is not until you put a gun to somebody's head before the person knows what to do. We can't keep living as if we don't have a conscience. It can't work. And until we start telling ourselves these home truths, I mean, it's just, we can't keep blaming each other. I keep saying it's one government or the other.
The point is, take Lagos State as a typical example. When one governor is there, they're following a particular set of blueprints. Another governor comes, they wipe. Everybody wants to wipe somebody's legacy. Can you imagine when Nigeria? No. Hold on now. Can you imagine where Nigeria would be today if war against indiscipline was still in effect today in Nigeria? Let's call a spade a spade. No,
but
I agree.
Why do you need to have
it's responsible?
No, it would have been a norm. It would have been a norm by now. For me, I think the next generation compared to my generation are going to be worse. Their etiquette is zero. Yes,
clearly.
They
haven't seen anything. They haven't seen anything
good. When we grew up, we were watching the likes of Okra Dawn. We were watching Mirror in the Sun. We were watching all those programs that had Village Headmaster that had proper ethics that would teach you. What do they watch now?
Yes.
I mean, when Buhari came to London to come and campaign, I saw a set of people holding placards saying Buhari cannot enter. When Jonathan came, the same set of people were holding placards. And still, there were a few of them that I knew. They were like junior brothers to me here in UK. And I picked up the phone, I called them, I said, Moyo, what's going on?
Hey,
bro,
it's not me.
Why you?
So Moyo,
I pick up the phone and I say, Moyo, but I saw you saying that Buhari was not the good guy, that you want to vote for Jonathan. But at Jonathan's campaign, you're also there saying Buhari is not good. And the next thing you say, bros, and they have school fees to pay now. They pay me £200. Can you imagine?
Who is paying them £200? Who is paying them that?
There's always going to be a campaign manager who is managing the affairs of both political candidates. So obviously, they need people to come to that place to make the other party look bad. So when you find the same set of 10, 15 people...
So hold on there, Mark. So now this, comes back to that issue of bad followership that I was talking about earlier on. Now,
if the leaders do not lay good load, the leaders first need to lay good example.
Hold on, Mark. These people have left Nigeria. They're now living in the United Kingdom. And they are still collecting a gunja of £200 to go and carry placard. What is their excuse?
School fees.
So, I had this argument, this discussion with one of my friends.
Just basically means you're not responsible. That's what it means for you to do that. Why would you not be within your means?
He said to me that, it's easy for someone who is comfortable to behave properly. Your mind is not occupied, with how you would meet your basic needs. You're not worried about how you're going to eat. You're not worried about whether or not there'll be power at home, or if your house will still be there, or whether or not your landlord will be around. That, so you're comfortable, right? And maybe he's right to some extent. I argued against it because I have friends and I know people who are comfortable, who still don't do the right thing. And I don't want to overflog it. I just feel like we want the government to do so many things, but we forget that as citizens, we do have our own responsibilities as well. There are civic duties. We all got taught that in school, like what's your civic duty as a Nigerian?
Social
exactly. So let's not forget that. But overwhelmingly, things are the way they are because, repeated governments have failed us. So there's no need for us to flog the issue. Like that one is clear. If the government did the right thing, and we had a South Africa type scenario in Nigeria, I mean, things won't be as bad as they are right now.
Okay, so you guys, I think we have overrun our time so far, but it's
Yeah.
been an interesting conversation, even though we still did not come up with solutions. So I'll just give each of you 2 minutes, to make a suggestion. Let's try to keep the conversation going, even offline. Social media
Okay.
handles, your friends, your colleagues. Let's, continuously discuss how can we resolve the issues, because there's so many people living, in the diaspora as Nigerians and they want to go back to Africa, but it's just not working. So ladies first. I'll take Moyo first.
How do we improve the situation? Right,
Yeah,
that's the question.
that's the question. How do we, how will you
You
move
know
forward?
what? You know, this may sound radical, but I do feel like we should forget about changing certain generations and start working from the younger ones and building character and like morality within that population.
Yeah,
Those will be the people that will those will be the people who would, you know, live to implement that our grand plan. Before you
yeah,
came, I said something. I said what we need is a China, Malaysia, Indonesia model to economic growth and development in Nigeria. Have a grand
yeah,
plan, concrete 20, 30-year plan. It doesn't matter which party you are voting for. It doesn't matter. It doesn't matter if it's APC or PDP. They implement that plan. Nobody digresses from it, right?
yes,
That's how I feel we can turn things around. Repeated governments coming to do tiny little things that don't move the needle, starting afresh from rather than continuing where the others stopped, is not really going to make a difference for us.
okay, all right, thank you. So Mark.
Well, for starters, the little bits of patches of solutions here and there that is being done on the state level, WHO, tuberculosis campaign and programs that Moyo alluded to is, I think we're creating a bigger problem that we need to solve, because in the next 10, 20 years, when somebody wakes up and smells the coffee, um,
Yes,
the first thing they would now want to say we need to do is to integrate all those ERP into one single database. And that, what have we done? We've created a colossal amount of work that needs to be done. We will get there. Um, for me, Nigeria is kind of taking two steps backwards, sometimes one step forward in certain areas, and some areas we're taking three steps forward, just one step backwards. So um, Nigeria is getting better at certain things. I don't think it's going to cost the government too much to implement the a solution that's going to be fit for purpose. And you know, Moyo has said it all when she said there are certain types of solutions that we can afford to copy because of the way our demographics is arranged across the
yes,
terrain in Nigeria. I mean, looking for a solution is not going to take you 3, 4 months to implement that across the nation. It just takes a bold leader to be able to say
Mhm.
this is what's going to be done, pass it to the House of Reps, let them sign off the bill and vote on it, discuss on it, and push it to the presidency. He reads it and he signs it into law. There's a lot that we can do, but I think sometimes Nigerians, our biggest enemy is ourselves as a nation, and I think we've not gotten to a stage where we are begin to look at ourselves as people who want to leave a legacy, not just for ourselves or for our generation, but for the future unborn generation. Imagine if an individual like myself or yourself, propose that kind of solution to the government and they were able to key into it. Whoever is the ruling individual, forget about the ruling party, that person will leave a legacy for
Mhm.
Nigeria for the rest of their dying
well,
days. And
well, we all hope to see something like that, in our lifetime, and
amen,
Amen.
a big one,
we'll
a
see how
capital
we'll
Thank
see
letter.
how
you.
that pans out. So it's been great having you guys on, and we hope to have you on again under different circumstances. Not talking about COVID-19, but things that have changed, things that have improved, things that are already working. So it's been great having both of you on, and hope to catch you and talk to you again soon. Bye, Moyo. Bye, Mark. So we've had a great evening, and I hope you've had a great evening too. And we've got a surprise coming on Sunday, and we hope you guys will be able to watch it at 4 p.m. on Sunday. We've got a very, very special guest, a giant, as a matter of fact, of a guest. And he is going to be on the show at 4 p.m. prompt, and he's going to come and tell his own story. He's a very interesting fellow, extremely so. He seems to have quite a lot of followers, and people love him. He's coming here to tell us why he's so loved. Thank you very much for joining us on the show. You have a good night, and see you on Sunday. Yeah.